Broadcasting Network TV, aka LCBN TV, is committed to bringing the transformation message of Jesus Christ into homes across the world, providing hope in the most desperate situations. We are passionate about souls, reaching the lost, the hurt, and the lonely, and by a click of a button, God can change a person's life forever. Watch LCBN TV channel 24/7 on UK Preview channel 271, Roku TV, Amazon Fire TV, Android TV, Apple TV, See Love World, Google TV, LCBNTV.com, LifeComTV.com. Download LCBN TV app from Google Play and App Store. LCBN TV, just in time.
Hello, good evening, and welcome to another episode of Health Matters. And I'd like to welcome all our viewers on our various platforms. Tonight, I've got a friend and a colleague, Dr. Samuel Ajetumobi, who is a general practitioner. He has been a medical practitioner within the NHS for over 24 years, and is also an esteemed colleague. We've gone years back. He has worked as a general practitioner for close to 17 years. He is a member of the Royal College of Pediatricians and Child Health, a diplomate of the Royal College of Obstetricians and Gynecologists, a diplomate of the Faculty of Family Planning and Reproductive Health. He is a member of the Royal College of General Practitioners. He holds a postgraduate certificate in medical education and has been involved in training of the next generation of general practitioners for over 8 years. He's currently serving as the co-training director for the Basildon General Practice Specialty Training for the last 3 years. It's my absolute pleasure to welcome Dr. Samuel Ajetumobi to the show.
Thank you, Nick.
Hi, Samuel.
Great
It's nice.
Thank you.
It's always a pleasure catching up with old colleagues. I've known Samuel for a while now, and one of the reasons why I felt that your experience and background as a general practitioner will help us is because of some of the issues that surrounds the health of men. Just before this show, I was speaking to some friends and church members about mental health and the need for men to start to take a different approach to how they manage their mental health. Because unfortunately, over years, we've all been brought up to be strong and macho, to hold this dominating power that nothing can go wrong with us, because we've got this massive biceps. And also the media hasn't been helping. Also, they give this picture of how men are brave and they're good at what they do, and they can't be vulnerable to anybody, and they tell you to man up rather than speak up, and all sort of other things. And I was telling my friends today that the Y group, mental health and physical health has no respect for your Y chromosomes. So it doesn't have a respect for your Y chromosome, because you carry Y chromosome doesn't mean that you can become sick psychologically or sick physically. So I'm hoping that apart from mental health, which I describe as a silent killer, physical health is also a silent killer, especially amongst men, people dying prematurely and things like that. So I'm hoping tonight we'll be able to shed some light and probably dispel some of the myth and some unrealistic expectation of men needing to be strong and in control. So thanks for joining us tonight. And I would like us to start about with actually just telling us what's the life expectancy of an average male in the UK at the moment, or maybe average across the world. What's the life expectancy?
Okay. So, in fact, in using the word life expectancy, what first comes to my mind is that what is life expectancy, so that we start on an even level. And really, the word life expectancy is a statistical measure of the average time that we might be expected to live. And in the UK, it's the Office of National Statistics that puts these things together. They kind of, put projected mortality, population projections, and say, based upon this and that, this might be the expected life expectancy of our population. So for men in the UK, as at 2019, there was about 85 years and a half. For women, it was 87 years or so plus. So
extra 3 years.
I mean, the interesting thing about the disparity, if you look worldwide, there's always that disparity between life expectancy for men and women. And depending on what part of the world you're looking at, that disparity can be under a year. And in some parts of the world, it can be up to 12 years. So there's a range of disparity, but everywhere in the world is always seen as women are expected to live longer than men.
Is there any particular reason why this is the case? And I'm sure you were expecting that question anyway.
So yeah, I've had a look at things, and they say women have the 2 B's, and the 2 B's are biological and behavior. So there's some biological advantages that women are seen to have that gives them a longer life expectancy. Biologically, the way I look at it is that the man that goes out and drives his car and has a spare tire in the boot has an advantage over the man that goes out driving without a spare tire. Well, women have 2 X chromosomes, so they've got a spare tire that when there's a problem with the genetic composition on one gene line, they've got another X chromosome that sometimes can compensate. So from a genetic point of view, women just do better in that area. And then many of us in the medical field, that estrogen, which is the hormone or chemical that makes a woman, gives women an advantage in that it looks after cholesterol better. So women have estrogen, men have testosterone. Estrogen helps lower cholesterol, or the fat that swims around in the bloodstream, and therefore, as long as up until the age of 50, women are less likely to suffer from, or to less likely to have things like strokes or heart attack. And I say less likely, it doesn't mean that some might not, but compared to the average man, estrogen reduces a woman's risk of that. Interesting enough, testosterone in men, with testosterone, there's an increased predisposition to violent behavior or risk taking. And if the more risk we take, whether physical risks, mental, emotional risks that we take, that puts more stress on us. So there's that disparity. The other thing under the biological thing is that the fact that a woman has the capability to carry or host another life means that they have to access and engage in the use of physical and mental resources that men do not usually have to access or make use of. And even in that, it means their bodies are better at managing stress. But those are the biological reasons that I've come across. The behavioral reasons, many of us will be aware of them. Women are more in tune with their bodies. They're more attentive to their bodies, and they're able to engage, because they're more attentive to their bodies, they're able to engage with deeper dialogue with their doctors and speak out and understand what's going on. Whereas many a time as men, we are not. We, like you said, we think of biceps, we think we're indestructible. Yes, so those 2 B's, biological and behavior, put women at an advantage, which you could say the behavioral one, you might not be able to, as a man, change the biological advantage, but behavior is learnt, and you can do something about that.
Thank you so much. It's actually interesting that you talked about that second bit, which is behavior, because over time, we've been wired to think in a particular way. And I'm sure if you were to take a percentage of how many people you see on a daily or weekly basis, women will probably take a larger proportion of people that you see or even calls that you get. Is that because we have learned this behavior because of the way we've been brought up? Or is that because there are other factors that just stop us from making that short trip to the GP practice or picking up the phone to speak to Dr. Ajetumobi?
Well, first thing, you're absolutely spot on. Tomorrow morning, I'm likely to take about 17 calls. In this COVID period, I'll take about 17 calls, and the chances are that at least 14 of those calls will be from women, and maybe 3 or 4 will be from men in relation to health. So usually between 75 to 80% of my morning appointments will be with women. And many times, sometimes some of the calls are from women calling on behalf
of their
of their spouses or their sons or their, women are the ones that are making the move to try to sort out men's health problems. So yes, that's very true, what you raised in practice. And then the next question was, why is this? Is it something we've learned? Is it something that we need to unlearn, or is it an environmental thing? I think it's a combination of factors. And I think, just like many things in the society we live in, it's education that will change it. It's education, and education starting from the grassroots. The younger our young men are, our boys, if we start changing or educating them in relation to their health, in relation to the way they think about their health, about their bodies, then we'll be able to change that behavioral factor.
Thank you so much. So when you look at the percentage of calls that, because we're kind of putting men's health into perspective tonight, when you look at those calls that you get, what kind of calls are they, if you don't mind me asking? What sort of things do you find men worrying about, and while they are probably ignoring some other important ones that they're supposed to be making calls about?
Well, first things first, in my about 17 years as a general practitioner, I find men of different age ranges calling in for different things. So if I've got a 17, 18-year-old boy, a young man, waiting for me to speak to him, or he's on my list that he's going to come in for a face-to-face, I can, safely bet that he's either coming in because he's got some kind of injury. That's one possible reason. Sports injury. So he's come to get it checked out, and he's coming in a couple of days or a couple of weeks after it's happened because he hasn't got better. Or usually, if they're young also, interesting, which I think is very good, is that I get lots of young men, late teens, early 20s, coming in because they've noticed something down below, which I think is really good, around the private areas that they're not sure, they don't understand, and they've come to see a doctor. So, which is good. Then when you now start getting into men into their 40s, again, the kind of calls that you would get from men in their 40s, or the face-to-face appointments you would get from them, will also be possibly related to things going on down below, in relation to testicles, relation to the male genitalia, and also sometimes family history, if they've been, again, encouraged strongly and robustly by their spouses, with a strong wagging finger that you need to go and see your doctor. A common opening statement I get is, I've been asked, I'm here today because my wife told me I have to be here. Then I say, well, if your wife hadn't told you, would you be here? And the response I get is, no, I'm just doing what I'm told to do. And I smile at that. So that's young men, middle-aged men, And then the older men, still very common, being told to be there because, and you ask them, are you worried? They'll say, I'm not particularly worried. However, my wife or my spouse or my mother has told me to come. Older men will come with issues relating to back passage, changes in habits, things they've noticed. But usually one of the things that as men, and which I'm not sure how much better I am myself, but we come slightly late. It's been going on for some time. Yeah.
And I think this for me is quite important because there are quite a large number of mental and physical ailments that is better managed if it's nipped in the bud quicker than when it's later. And the prognosis tend to be better also, and the outcome tends to be better. And I think what you still find from some of what you've said to me is that it's still got to do with a lot of things that we're talking about virility of man and all those things that concerns them more than whether they're having frontal headaches, backache, or or some other telltale signs that something is wrong somewhere else. And I still think it goes back to the fact that unless the masculine man is having issues, the man does not have a problem. And that's the way I put it for most people when I speak to them. So when we look at some of these medical problems, and some of the ones that they've not raised, what are the common ones that we will expect men to come and see their general practitioner for that are preventative or that we can prevent from getting worse? Because I know now that we have quite a large amount of people dying prematurely from heart attacks and things like that, which is obviously I will still suggest. I know I'm a psychiatrist, but I still think that's preventable if other things are put in place. So what are those common things that if you were to highlight to men and say, all right, in terms of health awareness tonight, I will be saying these are things that are important and possibly some of the telltale signs that might signify that something is wrong?
Okay. So again, in going to answer that question, the top 10 causes of death in men: heart disease, number 1, cancer, accidental injuries, strokes, chronic breathing problems, respiratory problems, diabetes, chest infections. Interestingly, at number 7 was suicide, then kidney disorders, and then dementia. In women, all of those, or 8 out of those 10 I mentioned, exist in some form in the top 10 for women, but 2 of them are missing. Suicide is not in the top 10 cause of death for women. That says a lot already. It doesn't exist in the top 10 for women. And the other one that doesn't exist in the top 10 for women is accidental injuries. But just let's take notes of that. Now let's look at the heart disease, how it might present and what men are missing out. What are the risk factors for heart disease? And again, as men, we think heart disease, well, there can't be anything wrong in my heart if I'm fit and I'm exercising or I'm busy at work. There can't be anything wrong with my heart. And the best way I try to gently explain this, or the example I usually give to men, is that I have a brother in my church. He's really fantastic. He'll come to the church car park and he will look at my car and he will my car, just look around at my car and say, I say, what's the matter? And he will just point out 2 or 3 things. Because of those things he's noticed, which I'm not good with cars. I wouldn't have noticed. He would say, because of that, doesn't look good. There's some telltale signs in your car that say to him, who understands cars, that you're going to run into some problems soon with your car, either the trim line on the tires, or he would just notice things. So I always say to men in the same vein, I can, as a GP, as a doctor, seeing men over and over, I can see a man from afar. You come up to me, we're talking, and I can say, ooh, you know, just seeing you, there's certain things I can see that we should be able to see and know are not good signs for our long-term health. And the one we always know, in fact, we're always struggling with, that we're working on, is our weight. We overlook it so much, and something that as men we must keep working on. And it's not just the whole weight, it's the central weight, the weight around the center, belly fat, as some in very layman's terms. It's called a measurement of your waist, the waist circumference. And usually I must say, it's not your hip circumference, it's not your belt line. Again, I guess that depends on where you wear your belt. But naturally, if the measurement around your stomach at the belly button on average, if that's more than 100 centimeters, or in inches, if you want to put it, more than 37 inches, then you have an increased risk of heart disease. You had an increased risk of high cholesterol. One is at an increased risk of diabetes. Now, of course, that's just one factor, but that's a factor that we have some relative control over. And I use the word relative because I know there are many factors that might play a part in that, but that's something that we can modify or work on. And even another factor, which again is not easy for some people, but we know it very well, that in some of our habits, one of the habit might be smoking. I remember when I used to work on a ward with a consultant in ITU, and he would take me onto the ward, and there would be 10 men on a ventilator. They had just had heart attacks in the last week. And he would say to me, we've got 10 men on the ventilator. And he would assure me that 7 out of 10 of them who are on those ventilators were smokers. At least 70% of men that were being ventilated on the ITU ward due to heart attacks were smokers. Smoking being one of the greatest risk factors for having a heart attack at some point in time or the other. Another modifiable risk factor is our alcohol intake. And again, there are various schools of thought as to how we as either human beings or men might might or might not engage with alcohol. But naturally, an indulgence with alcohol increases cholesterol levels. Cholesterol levels block up. Increased cholesterol levels will thicken arteries, reduce blood flow, and increase risk to heart attacks. So these are factors that we can work on and modify. And I think they're important factors that as men, with our drive, when we have a drive for business, we have a drive for our families, we should have a drive for our health. Because all these other things that we have that drive for sports, for health, for our families, well, those drives will not be there if we're not around, if we're not alive to engage and fulfill those visions that we have.
Thank you so much. I was hoping you were going to mention one, but maybe I'm free now. My wife will not stress me. It's diet, which is, I think, is one of the things that some of us, especially from the African part of the Afro-Caribbean and all that, where people think that big belly fat is a sign of good living. Now you've heard from the doc. Dr. Jutumori has made it clear to us that belly fat is not a sign of good living. So please let us make sure that we're not increasing it because we think that it makes us look like a big man. It's probably dangerous. In terms of looking at, you mentioned one thing, that most men will be breadwinners in their families or joint breadwinners with their wives. And I think one of the other things that tend to be a possible cause of a deterioration in somebody's physical or mental health especially as related to cardiovascular problems, like we said. What's the role of stress? What's the role of stress in this?
Thank you. Very good question. And when I use the word stress, when we use the word stress, I always say that one man's stress is another man's motivator. So stressors are not the issue. It's how we or may respond to stress. So a negative response to stress naturally can produce different responses in our body. So negative responses to stress can cause anxiety, can cause agitation, can cause irritability. These are all functional, emotional responses to stress. There are physical responses to stress, weakened immune system, an increased awareness of your heartbeat. We call that palpitations. The sensation of a lump in your throat, or an inability to swallow, to get a deep breath in. That's a response to stress. Call that globus hystericus, or a change in bowel habits because of stress. So stress can negatively impact us emotionally, physically, and also on our immune systems, eventually leading on to other things along the way. So it's how we respond to stress. Our coping mechanisms with stress play a big part to what stress can lead on to in our lives.
Yeah, thank you so much. I had one of my colleagues, Dr. Ayodele Ajayi, come talk to us about resilience and things like that. And I think this false expectation that men are brought up with can produce what I regard as possible negative resilience, in that you think that you can withstand any sort of pressure without seeking out or balancing things, which is why some of the issues that we've been talking about tonight, especially stress, is that men sometimes might even be too proud to ask for help when they feel that things are getting too much. Because, to be honest, a lot of us are working under enormous pressure, especially now with the COVID-19. And sometimes we come back home, and there's no time to distress because everybody's in the house. As opposed to the time when you have some time to kind of distress on your way back from work. Some of us are working from home and even doing more than we would normally do. Thank you so much for that, Dr. Ajetumobi. One of the things I'd like to mention to our viewers is that please feel free to send your live questions onto the chat, and I'll pass that on to Dr. Ajetumobi, and I'm sure it will help us out with most of it. So we've talked about a few things. You mentioned the 5 to 10 leading causes of mortality in men as compared to women. And it's interesting that you mentioned suicide, because for me, that is a big concern as a psychiatrist and as a substance misuse specialist. Because having said that, also alcohol dependence is also a way of coping with stress on the side of men, which increases the risk of completing suicide. So what are the things that are probably what you can regard as red flags when looking at those 10 leading causes of death in men, that you will probably suppose that every single man, if they're not thinking the way men think and they're thinking the way women think, will be on their way to the GP practice the next day?
Excellent. I like the way you put that. So I've kind of categorized, or in my mind, I'm thinking of the way to categorize that response. So, for example, there's certain things I say we call them safety netting. We would say to a patient that if this happens, if that happens, contact your GP immediately, or seek medical attention immediately. And the way to look at it, we can put this into systems. So if a man has new onset of chest pain. And this, it's new onset, it's at rest or with exertion. It may be your heart. It sounds, of course, we would know that. Well, not necessarily. Many times, there are other causes for such kind of pain, but it could be your heart. New onset of chest pain at rest, no particular reason, or pain that gets worse with exertion in your chest. It could be your heart. Yeah. Now, you would say blood stains in your phlegm. If a man coughs and there's a bit of blood in the mucus that comes up, that could be coming from your lungs. That could be the first sign or one of the signs of lung cancer. And so you should be speaking or seeking medical advice as soon as possible. Back passage, the digestion system, naturally, blood, new onset blood within the feces could be a sign of something going on in the bowels. An interesting one that I suspect many men might not know is that if your number twos or your poos change color to black, jet black, sticky. So if a man was to have, or anybody was to have an episode of black, tarry, sticky number twos, that could be a sign of internal bleeding. So it might not come out as fresh red blood. It could be a sign of internal bleeding. If a man was to vomit and bring up what we call, from a medical point of view, coffee granule substances, so it would be like altered blood, it could be a sign of internal bleeding. So these are some of the signs for heart, lung, and bowels. And if you want to talk naturally of brain or central nervous systems, slurred speech, facial weakness, one-sided weakness in the limbs, tingling sensations, we call that paresthesia. I think you might call that pins and needles, change in sensation in the skin. That might be signs of central nervous system problem, brain problems. And finally, for down below the genitals, again, naturally, if we were to notice lumps in around the testicles, most men generally are aware and they seek medical attention. Blood stain in the urine or even in the semen, very important to seek attention at some point in time and ask questions. There are some other signs of changes with passing water or spending a penny. If you're used to that in the United Kingdom, that's another way of saying it. But if you're going to pass urine or spend a penny and you start noticing changes in the flow, the onset, the stopping. In fact, the best way I like to explain this to men, because a lot of men are more au fait with cars, is that if you're driving a 1 liter engine car and you put your foot on the accelerator, you get a sluggish response. If you're used to driving a bigger engine, a 2.4, you put your foot on the accelerator, you get an immediate response. So if you want to pass water, you're passing urine, and you are at the WC and you want to start off, and there's a sluggish response, you're having to wait, there's some hesitancy before the urine comes out, then you know that something's not quite right. You need to speak or contact your doctors and have some discussions as to what's going on. And even when you put your foot on the brakes, there's a difference. If you've ever ridden a bike, if you ride a bike regularly, if you pull the brakes, the front wheel brake, and you pull the back wheel brake, there's a sharpness. In fact, there's a danger. You go over the bars if you pull the front wheel brake too sharply, because it will stop the bike dead, and it will be very sharp. So as young men, we're used to, you're passing water. When you want to stop, you can stop it, not a problem. But the older we get, we find out that you put your foot on the brakes and there's still some dribbling. There's still some urine coming when you're saying stop, and that can be a sign of things going on within the prostate, and it's a good idea to speak to your doctor.
Thank you. That is actually brings me to the next place, which I think for a lot of men is extremely important, and that's talking about the prostate. And if you will permit me, I would still like us to expatiate a bit on that, because I know that's quite a significant number of men who suffer with prostate-related problems without them realizing. Because I do know that if I can actually ask you, is it all prostate issues that are symptomatic?
No, that's a good point. There are, in fact, the C word, the one that we worry about mostly, could be asymptomatic for a very long time. So prostatic cancer could be asymptomatic for a long period of time. So, however, there could be earlier signs of it too. But there are many prostatic cancers that could have been asymptomatic. So if we're talking about the prostate, let's start from the easier things. And one of the things would be that always crosses my mind, that I ask men about their prostate, and a lot of men do not know. I know a lot of men do, but a lot of men do not know where their prostate is. I ask them, where is it? What do you think it does? And we're scratching our heads and thinking, well, is it here or there? Oh, it's about here, it's about there. So the prostate is a slightly circular, not purely circular, that's organ. Some people say chestnut size, if you're used to chestnuts, or small pear-sized organ that sits below the water bag, the urine bag, and it surrounds the exit of the water bag, and the tube that comes out of the water bag, we as doctors call the urethra. That tube, it surrounds that tube or encircles that tube and sits at the base of the water bag. So that's where your prostate is. You can't naturally feel it from the outside. It's there, and the job it does functionally, that's important for you to understand. The prostate produces a fluid that it serves as a medium. The fluid it produces allows the sperm that your testicles produce to flow a lot easier. So encapsulate the sperm are within that fluid, the semen itself, and it just allows a free flow of the sperm. It encapsulates the sperms. So that's what the prostate does, and that's where it is and where it sits. Now, it is affected by testosterone. It is the growth of your prostate, or how it grows, or how large it is or small it is, can be affected by the testosterone that your body produces, which is the male hormone. So it's important to know where it is and what it does. Now, in terms of the different kind of problems one could have with the prostate, the simplest problem that we might come across is that one can get an infection in the prostate gland, and we call that prostatitis. And the symptoms a man might have with an infection down there could range from painful urination, painful passage of water, of urine. Another symptom a man could have of an infection in the prostate could be blood in the urine. It could be blood in the semen. It could be swelling around the testicles, painful urination. So there are different kind of symptoms one could get with an infection around the prostate. The good thing, it's just an infection. Most of the time, it's easily treated with a course of antibiotics. So any of such symptoms, it's important to see your doctor as soon as possible, because this is a treatable problem with the prostate. So that's one common presentation of a prostate problem. The second one, which is also quite common, which is very common in men over the age of 40, is what we call a benign enlargement of the prostate, or medically called benign prostatic hypertrophy, which, just like I said, is just a benign enlargement or an enlarging of the prostate, which is not cancerous. How does that present? I think I've already mentioned some of the ways that might present with poor stream. So you can't hit the target as you used to be able to hit the target. The stream is not as strong. The ability to stop and start, there's less control in those areas. We either call it hesitancy or dribbling. So hesitancy to start, dribbling at the end of passing urine. And if you're starting to experience such signs, usually with most men over the age of 40, it might be a sign of your prostate being enlarged and beginning to affect the outflow tract. As doctors, we use the term lower urinary tract symptoms, LUTS, L-U-T-S. If you're noticing those symptoms, it just might mean your prostate is becoming enlarged and is squeezing on the outflow tract. And I think it's still good to speak to a doctor about that. Get it checked out, because it also could be a sign of something else. So if you're beginning to experience those symptoms, it would be good to say, give a call to your doctor. You're noticing this. What do you think? And you can be examined, you can be checked out, and taken from there. So that's an important, common, very common. So it doesn't necessarily mean it's something nasty or anything to worry about, but it's something that should be checked out. Benign prostatic hypertrophy. The last one is the one that many of us, we hear so much about. There's so much in the press about prostatic cancer, and all the symptoms or signs that I've mentioned for the other two, prostatitis, which is infection, or benign prostatic enlargements. All the symptoms I've mentioned for those two could also be symptoms that could present with prostatic cancer. So blood in your urine, blood in your sperm, they could be from prostatic cancer. Swelling or an inflammation around the testicles could be problems going on with prostatic cancer. A change in flow in your urine could be symptoms of prostatic cancer. So really, if you look at it, any symptoms going on down below there should at least be checked out. As a doctor, my job is to be sure that these symptoms hopefully are just due to any of these more benign causes, and make sure it's not due to the one that we don't want, prostatic cancer. So really, all those symptoms apply, and we should get them checked out.
Thank you so much. That has been properly dealt with for us, so that we can know the extremes of any issues with our prostate. But are there risk factors for any form, especially prostate cancer? Are there risk factors that we need to be aware of?
Yeah, definitely. If there's a family history of prostatic cancer, then whether a first degree relative, if one's father has had it, one's brother has had it, any first degree relative, then one is more at risk of it. And therefore you would be, in fact, even just having a family history of it, it's good to go to your doctors. And if you're above the age of 40, to just have that discussion, make some time and to say, well, doc, I don't think I'm experiencing any symptoms at the moment, but I just wanted to have a chat with you. I've made some time. My brother, my father I was told had this, and I'm above 40 now. What are your thoughts? What should I be looking out for? What should I be doing? And that's a way to educate oneself and prepare and plan and work on preventing. So a family history of prostatic cancer is definitely a risk factor. Afro-Caribbean men, again, whether from a genetic point of view, are noted to be more at risk than other races from prostatic cancer. And so therefore, again, if you've got a family history and you're an Afro-Caribbean man again, and you've got a few symptoms, then I think it would be prudent to, once you're above 40, to just pop down to doctors and have a chat. make time. I think the good thing about this society that there is no the only pressure you have to see a doctor is you making the time. That's you might say your time is valuable, but I guess if you were to add the cost of paying for it, you would think, some places the reason why they don't go and see a doctor is because they think, oh, how much is going to cost me. But so it's good to sit down and have a chat with a doctor. Those are the two main risk factors that would come to mind.
Yeah, you mentioned weight and central obesity earlier on. Has that got any role to play in risk of prostate or prostatic cancer? Because I'm not too sure whether it's got, but I've seen people mention that before, or hear people mention it before. I'm not sure how significant the risk is in people who are obese, whether there's any additional risk compared to normal people.
Okay, so as a direct causative, I have not come across that, but where I might see the association is that if a man comes to me with prostatic symptoms, I am duty bound as a doctor. If a man has prostatic or benign prostatic symptoms, I am duty bound to think not just of his prostate, but also to think of cardiovascular issues.
Okay.
Yep. So when I'm assessing a man who attends with dribbling of urine, a man who attends with hesitancy, apart from taking a thorough history around the prostate, I must also think that because a man is presenting with a prostate problem, he could have cardiovascular. There's an association between prostate problems and cardiovascular problems. So I must check his blood pressure. I would be thinking of checking his cholesterol levels. And of course, if you're thinking of blood pressure, cholesterol, then weight comes in. So I think it's an association more than a cause. You find that if a man has a benign prostate problem, if he has cardiovascular problems, then there could be weight issues. I must say, I've just come to my mind, I've left out one very sensitive but very relevant symptom of prostate problems, erectile dysfunction. So I left that out. And as men, that's very important to us that, again, if we are noticing erectile issues with erections, ability to initiate one, ability to sustain one, then again, it should be discussed. You should make some time to see a doctor. And as always, there are some level of normalities. As one gets older, things are never the same. But it's good to check out how normal, what spectrum of normality does the inability to initiate or the inability to sustain an erection, how much are those two symptoms related to a prostate problem? They could be symptoms of benign prostatic enlargement. They could be symptoms of cardiovascular disease. They could be symptoms of prostatic cancer, depending on where and what stage it is. And so those two symptoms are also very important to add to the other ones I've mentioned earlier on.
How common is that in diabetes? Erectile dysfunction too? Yes,
again, very common. So again, when we talk about erectile dysfunction, causative factors for erectile dysfunction are multifactorial. So anything naturally that affects the cardiovascular system, anything that reduces blood flow to a spongiform organ like the penis. So anything that affects the blood flow will naturally affect its ability to function. Of course, there's also the neuropathic, the neurons that also initiate that also. So in diabetes can, because of the microvascular problems or the small blood vessel problems that diabetes can cause, naturally diabetes can affect the nerves that will affect erections. Diabetes can affect the arteries that supply blood to the genital areas. It can thicken the arteries, cause cholesterol problems, and therefore lead on to other issues. So yes, it's very common in diabetes too.
Thank you so much. I just felt I needed to add that because most of your patients are talking about down below. So it's important we rule that out also. Yeah. And I think one of the things that some people, men, feel comfortable when they do is to, either if they can pay for things privately, they go and do a PSA, as if it's normal, then their prostate is in the best of shape. What is the role of prostatics specific antigen in making diagnosis of any prostate-related problems? Is it useful? Is this something that you as the GP will order at a particular age, or what's the usefulness of it while we're still on the prostate?
Yes, so many men will know that the test that Dr. Ajay mentioned, PSA, prostatic specific antigen, is a blood test that looks at juice or fluid that the prostate emits into the bloodstream. And if that blood test or that juice is found to be high within the bloodstream, it might be indicative, or it may be an indicator that one has a problem with the prostate. Note, I've not said it's an indicator that you definitely have prostatic cancer, but it may be an indicator. And I think one of the things why it is not an absolute is that the PSA, or prostatic specific antigen, yes, it comes from the prostate, but there are other reasons apart from prostatic cancer that can lead to a high PSA in the bloodstream. So that's very important to understand. So if we had a blood test done, or I had a blood test done for the PSA, and it came back as being 20, that's high. That could be indicative that I have prostatic cancer. However, if, like I do at the moment, at times I go out and exercise and ride a bike. If I do that test within 3 days of going out and riding a bike, or as I say to my friend, I say to many of my patients, if I get Bradley Wiggins off his bike and do a PSA on him, you think he's got prostatic cancer. Or if I do a PSA on Bradley Wiggins, it's gonna be high, because anything that massages the saddle of a bicycle massages the area around the prostate and causes an increased amount of that fluid called the PSA into the bloodstream. So that's a false positive. Also, if a man has engaged with intimacy with his spouse or partner within 3 days of doing the test, then you're going to get a falsely raised level. Yeah. Also, if a man has a urine tract infection around the bladder, or prostatitis itself, an infection around, it will give a false reading. So therefore, it's not specific.
Thank you so much. So when we talk about the prostate, I know we have in women some people who would just go out and just take the breast out because they are fearful of having breast cancer. Is that something that makes sense in men? What is the role, if somebody loses their prostate, what impact will that have on either sexuality or on the masculinity of the man? If somebody loses their prostate for any reason, either BPH or prostate cancer, does that cause any problems? Because I think sometimes that's one of the reasons why men don't go to doctors, because they tend to worry a lot about down below and the consequences of having any procedure. And I've had men talk about that before.
That's a very good question.
Any thoughts?
In fact, what you've done there is we call it a verbal cue. That is, a light bulb has gone in my head that I never really thought about as to in relation to when I'm talking to men as this is what's going to happen. I've never really, I can understand the testicles a concern about that if anything was to happen to them. But I've never thought that there would be that similar worry if the prostate was removed. Okay, so let's again. I like to think we were always taught in the days. You remember first principles? Days of medical school. Go back to first principles. So, where is the prostate? What does it do? What's its function? And that would where is it structurally located? And that would tell us if it is removed. That means whatever function it was supposed to perform, it would not perform anymore. And the main function it performs is providing a fluid or a medium for the sperm to naturally flow into and to make a smooth ejaculation. In fact, it is your prostate, if men are listening, it is your prostate that gives volume to your ejaculate. Would that be correct, Nee?
Yes.
Yeah. Okay, so it's your gives volume to your ejaculate, which then says that definitely if one's prostate was removed, a man's ejaculations would have less volume. It doesn't mean he will not ejaculate, but definitely will have less volumes. Now, one of the other things is the procedure of removing a prostate. Assuming because of any procedure that there are risk of complications, there are nerves. There are nerves in those areas. The prostate itself surrounds the tubing that comes out of the bladder. Of course, if there are casualties to the operation, if there's collateral damage, then one would worry about could it affect other things. But if all goes well and there's no collateral damage apart from a reduced volume of your ejaculate, I can't see what other problems should exist. The prostate does not produce the male hormone testosterone, so it should not affect a libido. It shouldn't affect a man's libido. The prostate has no part to play in erections. The nerves around the area, going back to first principles, stand to be corrected, but I can't see why not having a prostate should affect the erections. I think, again, this is where the crossing comes in. If you think of it, if a man has prostatic cancer or benign prostatic enlargement, there's an association with cardiovascular problems. So it means there's a chance a man already has thickened blood vessels and is already having problems with erections and is already going down that line. So when the prostate now goes out and maybe those things get worse, you now say it's because my prostate was taken out. Whereas really, we already had factors that were going down that line before.
Yeah. And really, does it affect fertility? It shouldn't, in a way. From what you've explained, will it have a significant impact on fertility? I
can't see a reason why it should. Okay, you could say the medium, the flow, how much is the semen, the extra fluid? Does it improve transport? Okay, transport of the sperm within the female tract. You know, there might be some issues there, but I don't think, and most men don't have their prostate taken out until after their 40s, if not into their 50s. So if there's a need for that. So, and most of the treatment now, really, you could say that the prostate being taken out is is not the first option in a prostate problem now. There are lots of other options for treatment.
Absolutely. Thank you so much for that clarification. So are there screening tests that you kind of will implore men to do at a particular age group to kind of search for certain problems that might be age related? Are there routine tests that men, I know women do their pap smear, they do their mammogram, and they do all sort of other things. Are there screening tests for particular age groups? Because I like the way you actually categorize the kind of calls you get into different age group at the beginning of the program. So are there specific tests that you regularly ask your patients to do when they get to certain age group?
Okay, so for men on the NHS, there's one screening test that is very specific to men, and there's another one that both men and women might do. But so for men 65 and above, there's a test that is available to men called the AAA screening, and the three A's are your tummy, abdominal aortic aneurysm, which is a kind of a summary for a bulge or a swelling in the large or the major artery that travels from your heart down and supplies blood to most of your body. So men are more prone to having a bulge or swelling in that major artery, and if it's more than 3 centimeters large, it can be an issue. And so on the NHS, men are offered a scan at the age of 65 to check for a swelling in that artery. And if you're around that age, you should be getting something in the post offering to come for a scan just to check on that. And if anything's picked up, so the screening test is once. If it is close to that 3 centimeters, then you get a regular review to see how large it is or how large it is enlarging. And the reason why they have a screening test for that is that the larger it is, the more at risk one is of it rupturing or bursting, and it can be monitored. And if it gets to a certain level, it gets repaired before it ruptures. So that's a very important screening test that men in the United Kingdom have available to them. The next one, which is available to both men and women, is the bowel cancer screening test, which basically checks for traces of blood or invisible traces of blood in your number twos or your poo or your feces, depending on which words you feel comfortable with. This test is available in some areas from the age of 55. A certain postcode lottery to starting at 55, whereas some areas started from the age of 60. And you will get something come out in the post to you. And so the best way to handle this, I've had this before, where some people would come into me and say, "Oh, I've lived in that area, I never got a test for this. I'm 58 now, and I've not heard about it." And I say, well, maybe where you lived in the United Kingdom, then they don't do it until the age of 60. So there are different age ranges, but if you're not sure, you've hit 55, you've not heard anything, again, just speak to your doctors and have a chat with your general practice, and they will find out when it's going to come out to you. But if you're above 60 and you've never received anything or heard anything, then definitely you should be contacting your GP, and they will chase up why you've not received a kit for the test for invisible or microscopic blood in your number twos. If you have a strong family history of bowel cancer, then you should be in a lot earlier to see your GPs from the age of 50, if not earlier than that, so that they can arrange not just an invisible blood test from your poo, but also they can arrange a camera through the back passage and a camera screening test on a regular basis.
Brilliant. Thank you so much. There's been this vitamin deficiency that is getting a lot of attention now, and I'm sure you probably know where I'm going to. It's vitamin D deficiency. Has that coming to the screening protocol of GPs, or is it still something that you must come in and demand by fire and by force to have it done by your GP? Because I know it's not something that is routinely done, but it's been implicated in virtually everything that we can think of at the moment. What's your opinion about vitamin D deficiency?
I think from the schools and the way we've been taught, the first things first is that the jury is still out as to vitamin D. So I know it's getting a lot of attention at the moment, but even a lot of the bodies that or the different colleges that are involved in in monitoring and managing around vitamin D issues. There's no consensus as to what is considered to be a normal level, or the impact that vitamin D deficiency might have or may not have upon various issues. And so therefore, one could say we could be jumping the gun to associate vitamin D with so many things. The best way to initially manage such things, just like everything, is to eat healthily. If I put together a couple of things in diet that have the best amount of vitamin D, and I was quite interested to find out that I rarely eat any of these things myself. Some of them, and many of us. So we're looking at, do I have enough vitamin D? Do I do things do I eat enough? Do I expose myself enough so that I would naturally have enough vitamin D? That's the question to start from. Yes, we know that vitamin D, a lack of vitamin D, can cause weakened bones. There's no doubt about that. People that lack vitamin D are more prone to fractures of their bones. That's very clear. They're more prone to low calcium levels and maybe feeling tired and weak. But the other symptoms that we've heard about of recent, in fact, I get people that come into me and say, oh, I'm always aching in my bones. I want my vitamin D level checked. And I kind of ask myself, as far as I know, having low vitamin D, it's not a standard thing to think that you should get pain or aches in your bones. Other reasons for that. But again, you take a thorough history, you do a thorough examination, and then you might do that test in relation to other things if you think it's required. So I think the jury is really out in relation to vitamin D. I personally, I will listen to people. I would want to look for other factors. But in terms of, we are not trained as general practitioners. There's no protocol or guidance that says that everybody that comes with this or that should get a vitamin D test. There's no evidence at the moment to say we must do this, but we will listen to people and understand their concerns and try to make sense of where they're coming from and why they're concerned, and then weigh up and decide whether there is a need. It would be helpful to do this in addition to other things.
Thank you so much. So for some of our viewers or listeners, we know that between October and early March, depending on how the weather is, where you don't have too much exposure to the sun, it might be what if Dr. Ajitumobi can tell us some of his dietary secrets for us to, because some of these things are just basic things that we just don't eat. I don't know whether you mind sharing a few of them with us.
Yeah, so it's again, you mentioned diet before, and I think there's a saying, you are what you eat. And many of us, for men, what we eat, the average man, and I use the word average, we're all different, but we don't pay much attention to what we eat. If the hunger is gone and the belly is full, we're okay. Or in terms of paying attention to what we eat, it's more of what we like. So we need to develop a diet conscious, a healthy diet conscious. And again, it starts from the young age. If we start educating ourselves and we start educating the younger ones also to eat healthily. So for vitamin D, I was just looking at something that has the highest foods with high vitamin D content. And I've got here herring, sprat, pichards. The only one I could really recognize that I would eat are sardines. It says rainbow trout. Note, all of these are fish for one reason or the other. Fish. Good fish. Now, even now, if I was to say to a man, how many men, okay, sardines we recognize quite well. But I used to eat sardines when we were in boarding house, when we were young. It's like, sardines these days. But you see, it's changing. It is changing. Young men that I know very well, and they're very conscious of what they eat. And sometimes they'll come down and just pick up 2 tins of sardine, open them up, just put them in a bowl, add something else, and maybe they could open 3 tins of sardines and just eat that as a meal. So getting the best vitamin D in. Foods with moderate vitamin D content: salmon, tuna, mackerel. Again, fish. Man must have his meat.
Yeah, that is true. And interestingly, you know, some of these things that you've mentioned are oil-based, and sometimes people get too conscious of this where I say, oh, my cholesterol, my this,
Yeah.
my that. But some of this they are oily fish. Really,
Yes.
they're oil-based. And so that means that combination is sometimes good for us. It's not all the time that it's bad. And I think that's what we need to understand, that it's too much of everything that is bad.
Yes.
Not actually eating things or in moderation is what usually causes a big problem.
Yeah.
Thank you so much. One of the things I found as a psychiatrist is that a lot of women present to you with non-specific symptoms. And when you begin to probe through it, it could be an underlying alcohol dependence, it could be anxiety disorder. But when they come to you, they don't tell you I'm anxious, they tell you I can't sleep. And when you begin to probe into it, that's where you realize that this is actually not just a sleep problem. The reason why I'm asking that is that for all that we've said today regarding cardiovascular risk, metabolic syndrome, and things like that, one of the things that come with that territory also is that people have this massive wide neck circumference. And you find that a lot of men actually with this big body habitus also suffer with sleep apnea. Because in my practice, I've actually seen quite a large percentage of men presenting to me with substance misuse that I've actually referred to their GP to be screened for sleep apnea. And I'll probably say about 85% of them have actually been put on the CPAP machine. What is the role of good sleep? Because men don't sleep. They believe that the less sleep they have, it makes them probably a better man, or maybe that's just my own mentality. But I think that people don't understand that you can't keep working without allowing your body to repair. How would you advise our listeners tonight on the importance of sleep and sleep hygiene?
Well, first things first, I'll raise my hand to say I'm guilty.
Guilty as charged.
I'm guilty as charged, because I guess I don't know, going through medical school, you know, sleep care, you know, sleep, you know, when you wake up, studying and sleeping, sleep can wait, you know, things like that. And I've carried that through to a lot of things I do, and I know it's not healthy. Sleep repairs the body physically, emotionally, mentally. Sleep has its role. It's like exercise. Exercise is to the physical body. Sleep is to the emotional and mental psyche. I just got that for the first time. That's one pulled out of the rock. But yes, sleep is to the emotional and mental body as exercise is to the physical body. And lack of sleep or improper engaging or poor sleep habits naturally will affect the whole body, the whole body. You mentioned sleep apnea, which for viewers, sleep apnea is a medical term for while one is asleep, because of either excess weight or a closing airway, your body, the airway closes down, you are unable to breathe, and one wakes from one sleep gasping for air or choking, trying to get air in. And Dr. Ajayi mentioned that a lot of men at some point in time then require a machine. Part of the treatment is called a CPAP machine, which is a face mask with highly pressured air being forced into the back of the airways and the throat and the mouth to keep the airways open while a man sleeps deeply. And again, if your collar size is the color of your shirt, if it's greater than 17, then there's a chance at some point in time you could develop sleep apnea. If one is grossly overweight, it's a risk factor for sleep apnea. And if we exercise regularly, have a good diet, these are less likely to happen to us. So really making an effort to relax, to sleep, to exercise. And when I say relax, in all forms, I'm going to go very general now with our health. Relax in the form of good relaxation, laughter, sitting down, laughing, having healthy relationships with people that are not stressing us out, having a good network of friends that strengthen us, singing, I don't know, playing an instrument, going on a cycling, healthy habits that relax us. I love watching comedies. I love to watch comedies and laugh, and we all have different kinds of comedies. Laugh, have people, because that helps. It releases stress. Or go out and sweat and do, is it basketball? Is it badminton? Whatever gets your heart going, gets the blood flowing. These things, you're more likely to sleep better at night if you've worked and exercised yourself physically. Now, let me understand me. You might say, well, I go to work and I'm mentally tired. Mental tiredness can stop one sleeping because the brain remains active even though it's tired. So I'm talking of a physical tiredness. That means the body is going to shut down and sleep. So there are lots of things in relation to sleep that will benefit us. I think Dr. Ajayi mentioned the fact from a stress point of view, one thing about stress is that it stops us or inhibits going off to sleep. And then even when one does go off to sleep, you find one is waking up on a regular basis in the night. So early morning waking, interrupted sleep. And that's because the mind is not shutting off. And those are common symptoms that we get with men. And like you said, Dr. Ajayi, a lot of people will not associate the problems they're having with sleep with other things going on around them.
Thank you so much. Thank you so much. So in terms of exercise, because you alluded to the importance of exercise, you've actually mentioned that all along in the program. And I know we can underestimate the importance of that. What would be the reasonable amount of exercise? Because I know also that some people do so much vigorous exercise before bedtime and they can't sleep. And they don't understand why they can't sleep. That what is... people will say half an hour here of walking 2 times or 3 times a week. As a GP, if I come to you with my 6 packs and I say, Dr. Yusuf, can you please advise me on how I can maintain my 6 packs with some math exercise, what would be the recommendation?
For you to maintain your 6 packs, I would say go and see a personal trainer.
Personal trainer, that's a good one. That's a good one.
So, yeah. So again, context. So everything is context. So I get a 20-year-old coming to me and I say, do you exercise? And say, yeah, I walk. I walk from here to there, 2 or 3 times a week. I said, you're 20, you're not 80. Those are my usual responses. I said, people your age are winning gold medals. You call that exercise for your age? So again, it's context.
Yeah.
Now, what's prescribed is anything that raises your heart rate for 20 to 30 minutes a day, between 4 to 5 times a week. Now, when people walk in a leisurely manner for an hour, and it doesn't either put you slightly out of breath or increase your heart rate, then it's not exercise, it's leisure. Exercise must either put you slightly out of breath or increase your heart rate. So if you work in an office building that has a lift and you're on the 5th floor, if you choose to go up the stairs every day when you're going to the office, I suspect if you're going to go up the stairs to the 5th floor, you know, depending on your level of fitness, you'll be slightly out of breath. That is some exercise. At least that's about, possibly to get to it might take you about 5-10 minutes. That's 5-10 minutes of exercise. If it makes you slightly out of breath, or by the time you get to the top of the stairs, you're kind of panting a bit, it means you've exercised. So exercise must make you slightly short of breath or increase your heart rate. That's exercise.
That is very informative, because I think that's, for men, they like things being put in context so they can understand what they're dealing with. And I think one of the issues for us over time is that we've grown up without things being described or explained to us in the context. And we have this global belief of how a man should be and how a man should live their life, as not showing emotions, not showing anything, which is one of the issues why we have quite a high suicide rate among men, because they just don't talk about their emotions. Women, you probably stop them from talking after a while, because they will talk to you about everything, including the cat next door that doesn't belong to them. They will talk to you about everything. But for us men, we tend to hide a lot of things. And I think one of the things that I found quite instructive tonight is the comparison between sleep and emotion and exercise and physical fitness, because that is actually quite interesting. Because you find out that a lot of people actually, if they don't sleep or they don't understand that they cannot function optimally, they're driving to work, they're at risk of having accidents, which we mentioned in one of the 10 causes of death in men, which is what? Accidents. And so you see that all these things have got a way of linking each other, which is why we cannot stop as men from discussing issues like this on every available platform that we have. One thing that I'm going to ask you, which I'm sure the viewers will not forgive me if I don't ask you, is this. I know that you are a Christian and you are a GP. And one of the things I found over time when talking about men's health or getting involved in mental health amongst men and things like this, or generally, is that Christians feel that they don't need to take their health to health professionals. And if you don't mind, I would like you to give us a little bit about what you think. What's the link between faith and seeking help when you have either emotional issues, psychological issues, or physical health issues, really? And why do people choose not to? I was joking with the men today. I said to one of the brothers there, I said, the last time you went to Nigeria, you didn't open Isaiah 51 and then with your luggage stood on Isaiah 51 and expect yourself to land in Nigeria. You went, you bought your ticket. You search around, you look for the best deal, you get a taxi to go to the airport and all that. But this body that we carry, which is the temple of the Holy Spirit, basically, we just treat it differently. So I don't know. You're happy to shed some light on that for us, if you may.
Yes. So always, I remember a good friend of mine always used to share a scripture. I'm just trying to remind from a Christian point of view. I think there's one that says, "Godliness is profitable to all things," and it says, "Bodily exercise profiteth little." Now, there's a scripture that says that, but I love. One of my brothers taught me again. He said to me, "But that little, that bodily exercise can give to you," he says, "he will get it." Are you with me? So, he says, the scripture says, bodily exercise profiteth little. But he says that little he wants to get. Tesco says, every little helps. Yep. So there's that context of understanding when scripture says something. Scriptures did not say bodily exercise is bad. Scriptures did not say bodily exercise will do you no good. It says it will give you something. Bodily exercise will give you something in addition to what your godliness will give you. Yes? And scriptures talks about wisdom in all things. Wisdom in all things. You mentioned that our bodies are the temple of the Holy Ghost. Now, an analogy comes to my mind. Among men out there that are listening to this, I'm quite sure there are men that are in the big time of owning different properties and are renting out their properties. You know, you've got portfolios of 1 or 2 houses here and there, and you're renting them out, and you have tenants. Now, if the tenant does not take care of the property that you've rented out to them, of course, you're not quite happy with it. You know, if they damage the property that you've rented out to them, well, the analogy is this: our bodies, the temples, are temples of God. We are rented. We're not landlords. They're rented out to us. These bodies are rented out to us. And I do not believe that God is happy when we do not take care of them. Just like you as a landlord that owns a property, you're not happy when your tenant messes it up, or, you know. So let's take that analogy to heart when it comes to our bodies, what we put into it, how we exercise it, how we take note of it. And again, it's a training. I'm quite sure I'm guilty too in these areas, but it's something for us as men to learn. Our bodies, if you're a Christian, our bodies have been, rented out to us by God to use. Let's look after them. If we see it in that context, let's look after the bodies well, do our best in terms of diet, exercise, take rest, sleep. Don't see it as being lazy. That's what we've been taught as men, that can wait, and things are deteriorating. And no, let's look after the bodies that God has given us, that He has rented out to us to use for our time here on earth. And let's not use spirituality as an excuse, to not take proper care. I've had people come to me because I understand. I've had people come to me complaining of symptoms, and I look at and I think about the symptoms they're telling me, and then I look at the person, and because I might understand their background, I then realize that, let me just double check. When was this symptom you're complaining of? Just out of interest, when was the last time you ate? We're on the person then tells me, we're on a 7-day or a 40-day dry fast. And I say, okay, well, did it not link up that the symptom you're having which is a stomach ulcer, might be due to the fact that you have not drank water or eaten food for X number of days? It's understanding our bodies, understanding health, educating ourselves, and being aware of the consequences of the things we might choose to do. And even if we do things, we do them in the safest way. We shouldn't feel guilty in understanding if we do this or do that. So that's one of the prime examples I've come across many a times.
Thank you so much. And we're running out of time. I could continue for the next 2 hours engaging you in this lovely conversation that we're having, but we're running out of time. I will ask you, Dr. Yitomi, that what would be your last comment to our viewers tonight in regards, especially the men, about the importance of looking after their mental, physical, and mental well-being? And what will be the last parting words for our viewers tonight?
So for our emotional and mental well-being, the simple thing to say would be for me to say is be happy, but knowing what it takes to be happy. To be happy, to be relaxed, to not overburden oneself with expectation, not allow others to overburden you with expectations. I'm putting these into context. Don't overburden yourself, and don't allow others to overburden you. Don't put yourself under unnecessary pressure. Love those that are around you. Love people. Laugh with people. Laugh with family. Create time to relax. Create time to laugh. Create time. This is more from the emotional, mental health point of view. Right? Go away, relax, come back sometimes, and you've got a lot to do. Decide that, you know what, I'm dropping everything. I'm just going to sit down, put my feet up. That's it.
Relax.
Great time to relax. I'm going to bed. Wake up later on. Very important from the emotional, mental health point of view. From the physical health point of view, that requires a lot more intentional. I use the word intentional plans. So intentional in the sense that you've got to say to yourself, I'm going to look after, and these are the things I'm going to do. I have a plan. I'm going to exercise. I'm not eating this anymore. I'm going to stop eating this. I'm going to start doing this. And as always, we're human beings. Sometimes we take a few steps and we fall down. We take a few steps backwards in trying to implement those plans. But we get up again. Scriptures, if you're a Christian, says the righteous falls 7 times, but he gets up again. Well, even in your plans to implement these healthy habits, you might fall back, but you get up again and go back to them, because in the long run, they do us good. They do us well. And I don't think we should shy away, because in the end, it's what we've done. God does not need to help us to do those things. In a sense, He's given us the ability to do them. He's given us we have the mind of Christ that allows us to think, right? We have by God's grace, if we have a steady mind, we're able to plan, to execute our plans. Yes, Scripture says that, you might have plans, but God helps. It has the final say, but it's still for us to make that effort and allow God to bless those efforts, even in terms of exercise, good diet, emotional health. So that's what crosses my mind. Yes.
Thank you so much. So for men, emotional intelligence is quite important. And like Dr. Ajitumobi has said to us tonight, it's not only about your muscles, it's also about your ability to look after the temple that the Lord has given to you. And one of the things I know is that if a man leads on this and carries the family along, it fosters relationship in the home. It makes everybody emotional, psychological, and physically fit. And it's just a good thing all around. And don't forget that for men, in our mental health, we don't talk about mental health. We tend to act out our mental issues. And so I'm hoping that one of these days on the program we'll be able to kind of touch on that. Because of time, I've not been able to engage Dr. Ajitumobi in issues regarding mental health. But one of the problems with men is that we don't talk. And sometimes because we don't talk, our women find it very difficult to identify when we're in trouble emotionally or psychologically, and things just roll on until there is a major breakdown. And that is not what we want. So all these things we've talked about tonight will also allow us to live a good life generally, and the family bond will improve and things will get better. I cannot thank you enough, Dr. Ajitumobi, for being on the show. It's always a pleasure seeing you. And I'm sure our viewers tonight will join me in saying thank you for a job well done, for breaking those things and issues around men's health. And I'm hoping that a few of our viewers tonight will have get 1 or 2 things that they can run with and can improve their mental and physical and emotional well-being. So for me, for men, sleep well. All right. And from Dr. Ajayi, I'm signing out on Health Matters until I see you again.
Thank you.
All right. Thank you.
Lifecom Broadcasting Network TV, aka LCBN TV, is committed to bringing the transformation message of Jesus Christ into homes across the world, providing hope in the most desperate situations. We are passionate about souls, reaching the lost, the hurt, and the lonely. And by a click of a button, God can change a person's life forever. Watch LCBN TV channel 24/7 on UK Freeview channel 271, Roku TV, Amazon Fire TV, Android TV, Apple TV, See Love World, Google Google TV, LCBNTV.com, LifeComTV.com. Download LCBN TV app from Google Play and App Store. LCBN TV, just in time.